Kidney Disease Patient Education Program. This course is designed for healthcare providers to counsel patients with chronic kidney disease about managing their disease and preparing for renal replacement therapy. Chronic kidney disease, or CKD, is best identified and treated early as part of comprehensive primary medical care. Goals of medical management are to identify and treat, monitor, slow progression. Treatment options for kidney failure. Peritoneal dialysis. At the end of this section, patients should be able to answer the following questions. How soon should I start learning about what type of treatment to have? What are my treatment options for kidney failure? What are the basics about peritoneal dialysis? Does dialysis cure kidney failure? When do I have to start dialysis? How soon should I start learning about what type of treatment to have? As your kidney disease gets worse, your healthcare provider may talk to you about preparing for kidney failure. Talking early with your provider about your treatment options and making a choice before you need any one of these treatments helps you take charge of your care. Treatment will help you feel better and live longer. Understanding the treatment you choose and getting used to the idea that you need this treatment takes time. Each type of treatment has pros and cons. Your choice of treatment will have a big effect on your daily life. By learning about the differences among treatment options, you can choose the one that will be best for you. The more you know about the types of treatment, the better prepared you will be to make a choice. Start learning early about treatment options before you need one. You'll have time to learn about the different treatment options, talk with other people who are living with dialysis, a transplant, or conservative management. Share your thoughts with your family and loved ones so they can learn about your treatment choices too. Work with your healthcare team to create a kidney failure treatment plan. Prepare yourself mentally and physically for the changes ahead. Creating a treatment plan and sharing it with your family gives you more control. Treatment options. You can choose one of 3 treatment options to filter your blood and take over a small part of the work your damaged kidneys can no longer do. A 4th option offers care without replacing the work of the kidneys. None of these treatments will help your kidneys get better. However, they can help you feel better. Hemodialysis uses a machine to move your blood through a filter outside your body, removing waste. Peritoneal dialysis uses the lining of your belly to filter your blood inside your body, removing waste. Kidney transplant is surgery to place a healthy kidney from a person who has just died or from. You will find information about peritoneal dialysis on this page, including answers to the following questions. What is peritoneal dialysis and how does it work? What are the types of peritoneal dialysis? Where can I do peritoneal dialysis? How do I prepare for peritoneal dialysis? How do I perform an exchange? What changes will I have to make when I start peritoneal dialysis? What are the possible problems with peritoneal dialysis? How will I know if my peritoneal dialysis is working? What is peritoneal dialysis and how does it work? Peritoneal dialysis is a treatment for kidney failure that uses the lining of your abdomen or belly to filter your blood inside your body. Healthcare providers call this lining the peritoneum. A few weeks before you start peritoneal dialysis, a surgeon places a soft tube called a catheter into your belly. How will I feel when the dialysis solution is inside my belly? You may feel the same as usual, or you may feel full or bloated. Your belly may enlarge a little. Some people need a larger size of clothing. You shouldn't feel any pain. Most people look and feel normal despite a belly full of solution. What are the types of peritoneal dialysis? You can choose the type of peritoneal dialysis that best fits your life. Two options are available: continuous ambulatory peritoneal dialysis, or CAPD, or automated peritoneal dialysis, APD. The main difference between the two types of peritoneal dialysis are the schedule of exchanges, and one uses a machine and the other is done by hand. If one type of peritoneal dialysis doesn't suit you, talk with your doctor about trying the other type. CAPD doesn't use a machine. You do the exchanges during the day by hand. You can do an exchange by hand in any clean, well-lit place. Each exchange takes about 30 to 40 minutes. During an exchange, you can read, talk, watch television, or sleep. With CAPD, you keep the solution in your belly for 4 to 6 hours. How do I prepare for peritoneal dialysis? You will need to have surgery to put in your catheter. Before your first treatment, you will need to have surgery to place a catheter into your belly. Planning your catheter placement at least 3 weeks before your first exchange can improve treatment success. Although you can use your catheter for dialysis soon after it's placed, the catheter tends to work better when you have 10 to 20 days to heal before starting a full schedule of exchanges. Your surgeon will make a small cut, often below and a little to the side. Where can I do peritoneal dialysis? You can do both CAPD and automated peritoneal dialysis in any clean, private place, including at home, at work, or when traveling. Before you travel, you can have the manufacturer ship the supplies to where you will be going so that they are there when you get there. If you use automated peritoneal dialysis, you'll have to carry your machine with you or plan to do exchanges by hand while you're away from home. Peritoneal dialysis training. After training, most people can perform both types of peritoneal dialysis on their own. You'll work with a dialysis nurse for 1 to 2 weeks to learn how to do exchanges and avoid infection. Most people bring a family member or a friend to training. With a trained friend or family member, you'll be prepared in case you have a sick day and need help with exchanges. If you choose automated peritoneal dialysis, you'll learn how to prepare the cycler, connect the bags of dialysis solution, place the drainage tube. If you choose automated peritoneal dialysis, you also need to learn how to do exchanges by hand in case of a power failure or if you need an exchange during. How do I perform an exchange? You will need the following supplies: a transfer set, dialysis solution, supplies to keep your exit site clean. If you choose automated peritoneal dialysis, you'll need a cycler. Your healthcare team will provide everything you need to begin peritoneal dialysis and help you arrange to have supplies such as dialysis solution and surgical mask delivered to your home, usually once a month. Careful hand washing before and wearing a surgical mask over your nose and mouth while you connect your catheter to the transfer set can help prevent infection. Use a transfer set to connect your catheter to the dialysis solution. A transfer set is tubing that you use to connect your catheter to the bag of dialysis solution. When you first get your catheter, the section of tube that sticks out from your skin will have a secure cap on the end of it to prevent infection. A connector under the cap will attach to any type of transfer set. Between exchanges, you can keep your catheter and transfer set hidden inside your clothing. At the beginning of an exchange, you'll remove the disposable cap from the transfer set and connect the set. Use dialysis solution as prescribed. Dialysis solution comes in 1.5, 2, 2.5, and 3-liter bags. Solution contains a sugar called dextrose or a compound called icodextrin and minerals to pull waste and extra fluid from your blood into your belly. Different solutions have different strengths of dextrose or icodextrin. Your doctor will prescribe a formula to fit your needs. You'll need a clean space to store your bags of solution and other supplies. Doing an exchange by hand. After you wash your hands and put on your surgical mask, drain the used dialysis solution from your belly into the drainage bag. Near the end of the drain, you may feel a mild tugging sensation that tells you most of the fluid is gone. Close the transfer set. Warm each bag of solution to body temperature before use. You can use an electric blanket or let the bag sit in a tub of warm water. Most solution bags come in a protective outer wrapper, and you can warm them in a microwave. Don't warm a bag of solution after you have removed its wrapper. Hang a new bag of solution on a pole and connect it to the tubing. Remove air from the tubes. Allow a small amount of fresh, warm solution to flow directly from the new bag of solution into the drainage bag. Clamp the tube that goes to the drainage bag. Open or reconnect the transfer set and refill your belly with fresh dialysis solution from the hanging bag. Using a cycler for automated peritoneal dialysis exchange. In automated peritoneal dialysis, you use a machine called a cycler to fill and drain your belly. You can program the cycler to give you different amounts of dialysis solution at different times. Each evening, you set up the machine to do 3 to 5 exchanges for you. You connect 3 to 5 bags of dialysis solution to tubing that goes into the cycler. 1 bag of solution for each exchange. The machine may have a special tube to connect the bag for the last exchange of the night. At the times you set, the cycler releases a clamp and allows used solution to drain out of your belly into the drain line. Warms the fresh dialysis solution before it enters your body, and releases a clamp to allow body temperature solution to flow into your belly. A fluid meter in the cycler measures and records how much solution the cycler removes. Some cyclers compare the amount that was put in with the amount that drains out. This feature lets your doctor know if the treatment is removing enough fluid from your body. Some cyclers allow you to use a long drain line that drains directly into your toilet or bathtub. Others have a disposal container.